You're looking for hair loss solutions, and you keep hearing about drugs that block a hormone called DHT. But here's the fact. Common oral versions are generally not recommended for women of childbearing age. The reasons are serious, involving fetal development risks and your own hormonal balance. So if these are off the table for many women, what are the effective and safe options? We'll compare prescription topicals to potent natural alternatives to find out what actually works. First, let's meet the culprit. What exactly is DHT and why is it a problem for women's hair? DHT is a potent androgen, a male sex hormone. In excess, it shrinks hair follicles on a woman's scalp. And it's a myth this only affects men. In women, it often shows as diffuse thinning across the top of the head. Conditions like PCOS frequently involve high androgen levels, increasing susceptibility to DHT-related thinning. During menopause, as protective estrogen levels drop, the hair thinning effects of DHT can become far more noticeable. Okay, so if DHT is the problem, how exactly are blockers supposed to stop it? Most blockers target an enzyme called 5-alpha reductase. This enzyme converts testosterone into HAID, the more potent DHT. Blocking this enzyme lowers DHT levels. It sounds like a direct solution. So why the major safety warnings for women? This is where we must separate oral from topical treatments. An oral blocker alters hormones system-wide. This systemic effect can trigger side effects like irregular menstrual cycles and breast tenderness. It can also lead to lowered libido, headaches, and dizziness. You are affecting your body's entire hormonal balance. Most critically, these drugs pose a significant risk to a developing male fetus, which is why they're rarely prescribed to premenopausal women. So, are all prescription DHT blockers a no? Not exactly. This is where topical solutions change the equation. Topical DHT blockers, applied directly to the scalp, offer a major advantage. They target the follicles locally. This localization drastically reduces the risk of systemic side effects. It gets the medicine only where it's needed. Research into topical finasteride for women is emerging, and early results are promising, but more studies are needed. One small study did find oral finasteride effective for postmenopausal women, but at a higher-than-standard dose. Prescription topicals are one path, but what if you want a non-pharmaceutical approach? Are there natural options? Remember that 5-alpha reductase enzyme? It turns out, several natural compounds are believed to inhibit that same enzyme. The most studied of these is rosemary oil. One study found it was just as effective as 2% minoxidil for hair regrowth. Another promising ingredient is pumpkin seed oil. One study on men showed it led to a 40% increase in average hair count. While much safer, the trade-off is that natural options may be less potent or take longer to show results. So, let's put all the pieces together. What is the final verdict on DHT blockers for women? First, oral DHT blockers carry significant hormonal risks and are generally avoided for premenopausal women. This is the main safety takeaway. Second, topical blockers and natural options, like rosemary oil, present much safer, genuinely promising avenues for targeting DHT at the scalp. Third, regardless of the path you choose, early action is vital. These treatments are better at preventing loss than regrowing it. The truth is, DHT blockers can work for women, but the right choice depends on your life stage and personal risk tolerance. It's also wise to remember they can slow thinning, but may not be a complete reversal for everyone. Manage expectations. Your first and most important step is to speak with a board-certified dermatologist. They can diagnose the cause of your hair loss. Understanding the science behind the options is the key to advocating for your own health and finding a real solution.